Good evening, everyone, and thank you for joining us tonight for this special Just for Kids presentation. I'm Chris McIntosh, and this evening we are talking about our kids going back to school and doing it safely. This is a call-in show. I want to encourage you to call the number that you'll see on your screen right now, and please, with any questions you might have for our experts. So please become part of this conversation this evening. Right now, let me introduce you to those experts. First, we have Tiffany Alford, the manager of the Children's Resource Center, and Dr. Tim Fuller with Ballad Health Medical Associates and Green Mountain Pediatrics in Greenville. Good evening and welcome. Thank you all for being here today. Tiffany, we're going to start with you because we're going to talk about, before they even get into the classroom, keeping our children safe in the bus lines and the pickup lines. What tips do you offer for parents as far as safety is concerned when dropping off or getting their children to school?
Well, we always like to remind parents and kids about safe distances from buses. That's a big one. So when you're waiting on the bus, walk your child to the bus stop and wait with them just to make sure that you can monitor and make sure they're staying safe. And encourage them to stay 3 giant steps, because their steps are a little bit smaller than ours. So encourage them to stay 3 giant steps from the edge of the curb just to make sure they're not accidentally getting too close to the road. And just encourage them to always wait until the school bus comes to a complete stop. That stop bar's out and the doors are open before they load the bus.
And for parents, I know that a lot of parents will drop kids off at school and everything. Things that parents need to keep in mind when they're making that trip to school.
Yeah, so as you're making that trip to school, I know the morning rush can get hectic and we want to just jump in the car and go, but make sure that you're buckling kids in no matter how far you live from the school. It's important that we're still buckling those kids in. And a lot of people, and I know a lot of us have done it, we like to put the backpack on before we get in the car, buckle up with that. That way we can just jump straight out in the car rider line. But we really want to stress that safety is more important than convenience here. And so having that backpack on can actually impact the way a seatbelt holds a child in a crash. So we definitely want to keep them safe rather than just speeding up the car rider line a little bit.
And I know dropping kids off and picking kids up in the afternoon, a very important thing to keep in mind as well. Should you designate exactly who you want picking your children up? Should you talk to your children about that situation?
Yeah, so we definitely want to make sure that your child knows who's picking them up and what vehicle they'll be in. So there's no question about who they're going to when they leave school. And we also want to make sure that designated person has all of the safety equipment they need. So whoever might be picking the kid up, make sure they have that car seat or booster seat and they know how important it is that we buckle up when we get in the car.
And doctor, all right, we've got them safely to school, we've got them safely home from school, but while they're in school, you know, we've been noticing, and I have references in my own family of this happening, there's a lot of sickness happening as school gets started again. Talk to us about what tips you have for parents to keep their kids healthy as school begins this year.
Sure, Chris, that's a very good question because this happens every year. So the kids are out for the summer and then when they come to school, they congregate and then they do what kids do, and they like to be social, they like to share, they like to play and roughhouse with each other. And while they're doing that, they're bringing their germs and they're sharing their germs. And so rather than having to end up in my office, parents would like to know, what can I do to prevent these doctor visits if possible? And so I do have a list of things we're going to talk about, but the first one is going to be hand washing. Okay, that is the most important thing, and it's important that you train your children how to wash their hands. Okay, so when we're talking about hand washing, we want to use soap and water, and we want to lather up, and we want to scrub all the way up to the elbows. We want to do that for 20 seconds. Okay, so how long is 20 seconds? So your kindergarten may not know that, but they may know their ABCs, and they may know the ABC song. So if they can go through that ABC song twice, that's about 20 seconds. Okay, so that's the general rule. Now, they should wash their hands, obviously, if they've, right before they eat, they should wash their hands if they've been to the bathroom. They should wash their hands if they've been out playing. And also when they come home from school, so they're not spreading these germs to their siblings as well. So if there's no soap and water available, hand sanitizer is a good option as well. And speaking of those hands, okay, so kids, you know, they like to put their hands on their face. in their mouth, sometimes in their nose. And so discouraging, keeping the hands away from the face. We want to discourage touching the face and chewing on fingers and biting nails. Keep your nails clipped so that you're not biting them in the classroom. Also, there's other things that also find their way to the mouth, things like pencils, erasers, books, toys, things like that. So kids need to be trained by the parents not to put these things in their mouth.
No foreign objects.
That's right. Just leave the hands and the objects where they're at. And then that goes on to, kids love to share. Okay, so they get to school and they say, hey, what is that you're eating? Can I have some? So we're not trying to discourage sharing here, but we want to teach them how to share in a way that's going to be a little safer for them, not to spread germs to each other. And so the best way to do that is to divide up these snacks or drinks into separate containers before you share them, okay? So that you don't have a dozen hands reaching into the same chip bag or cookie bowl, or, a lot of people drinking out of the same soda can, or using the same straw, or even using the same utensils, okay? So we want to try to separate out that food before they actually start sharing, okay? But we do encourage sharing, but just safely. So the other thing is, a lot of people ask me, well, what can I do, doctor, to help my kid's immune system? And of course, there are a lot of things out there that you'll see that are vitamins and supplements and so on like that. But really the best things you can do is to try to maintain a healthy immune system, okay? And so there's some things you can do. One is to maintain a healthy diet. That means eating lots of fruits and vegetables and a varied amount of diet, not just carbohydrates. And I know a lot of kids are carbohydrate junkies, and that's what they want to do.
Yes.
Yeah. But try to get a variance of diet and maintain that. It's also important to maintain regular exercise. And this is something nowadays that a lot of kids just don't do. I have kids in my office and I ask them, what do you like to do? And I would say probably 90% of the time they say, play video games, and so, but when they're playing video games constantly on the couch, and doing this, they're not out there exercising, they're not out there moving. But we know that when you're exercising and you're getting your heart rate up, it's doing more than just helping your overall health, it's helping to strengthen your immune system as well. So we want a healthy diet, we want regular exercise, and then the third component of that is sleep. Okay,
Right.
So a lot of kids, they like to stay up late. Especially on the weekends. They're saying, "Oh, it's not a school day the next day. Let me stay up." But it's important to get that sleep, because when we sleep, we're allowing our immune system and our body to rejuvenate and to heal ourselves. And so that combination of a good diet and getting regular exercise and getting good sleep, that's going to keep our immune system nice and healthy. Okay, so that's another thing we want to do. And then lastly, we want to make sure that we are current on our vaccinations as well. Because if you've got your flu shots, you've got your school vaccinations, that's going to help you to strengthen your immune system as well, so that you don't catch some of these things that may be coming through from your classmates. Finally, if your child is sick, okay, if they have a fever, please keep them home.
Absolutely.
Yeah. So don't let them go to school with a fever. But if they come to school and they still got a cough or sneeze, we want you to teach them to cough or sneeze into their elbow, or use a tissue. Don't cough directly into their hands. Don't cough directly onto their neighbor, okay? Because that's how these things are spread. So if we can teach them the safe way to cough, and also if they are sick, kind of discourage them from sharing so much. So maybe not share their school supplies with others or their snacks with other people if they go to school and they're still sick.
All right.
So those are some things that can be done.
Covered a lot of ground there, and we've gotten off to a great start in this Just for Kids Back to School special this evening with some very important information, and we want to hear from you and your questions for our experts. Just call the number you see on your screen right now. That is 1-888-903-9545. We have some folks standing by right now that will take your questions and we'll give those to our experts to provide the answers, and we'll be right back right after this short break.
The Niswonger Children's Network is growing. We've added new pediatric ERs in both Kingsport and Bristol. We're adding 2 new floors to our children's hospital in Johnson City. And across the region, we're working with medical providers and community partners so even more kids get the quality care they need. Yes, the Niswonger Children's Network is growing, just like our patients. Learn more at balladhealth.org/hope rising.
What does it mean to have a trauma network in the Appalachian Highlands? It means trauma care starts the second you connect with medical personnel after injury, not just when you get to a dedicated trauma center. It means that through a community partnership between Ballad Health, local EMS, specialized trauma doctors, and ETSU's Quillen College of Medicine, we are all working together to save lives and limbs. It means that no matter where you live, if you're hurt, we'll get you to the right place at the right time for the right care.
The Niswonger Children's Network is growing. We've added new pediatric ERs in both Kingsport and Bristol. We're adding 2 new floors to our children's hospital in Johnson City. And across the region, we're working with medical providers and community partners so even more kids get the quality care they need. Yes, the Niswonger Children's Network is growing, just like our patients. Learn more at balladhealth.org/hope rising.
Welcome back to our Just for Kids Back to School special as we look at all aspects of keeping our children safe as they head back to the classroom. And we want you to be a part of the discussion this evening. So just call the number you see on your screen right now with any question you might have for our experts, Tiffany Alford and Dr. Tim Fuller. And Dr. Fuller, we got a question on the line just a moment ago, and it says, it's from Elizabeth, and they want to know, is there still a quarantine for COVID at school? And a two-parter, also, do they have to wear masks after they go back?
Okay, that's an excellent question because we actually are seeing a rise in some of the COVID as the kids go back to school, and it's actually mainly in the schools that we're seeing it. So it's not in huge numbers, but we are seeing that growing, and we expect we're probably going to see an increase in amount of this in the next few weeks to months. And so at this point in time, the type of variants that we're seeing are some of the milder variants of COVID. They're mainly causing upper respiratory symptoms, not a lot of lower respiratory symptoms, not a lot of hospitalizations. So the current recommendations for quarantine, if you have COVID, is 5 days. Okay, so that what that means, the way they count this is the day one is really your second day of illness. So let's say you got sick on a Monday. Tuesday is day one. So that's how you count it up to 5 days. Now, if you're still sick and having symptoms after 5 days, you might want to consider wearing a mask for the next 5 days. But really what we're seeing for most of these kids is usually 3 to 4 days into this, they're so resilient, they're already feeling fine and symptom-free and ready to go back to school.
And when they go back to school, Tiffany, we got another question that came in. Let's talk about cell phone usage, because a lot of kids are spending a lot of time on their cell phones. Should parents set boundaries for use? I know schools do for the most part. Should parents set those boundaries as well?
Well, I think going back to getting to school, that's a really important thing to keep in mind. When we're in those crosswalks, on those sidewalks, we want to remind kids to have heads up and phones down and take those headphones out so that they can hear any oncoming traffic or anything. So that's really important for the transportation piece. And then those teen drivers, as they're heading back to their high school, remind them how important it is to not drive distracted and to not be looking at their phone while they're driving. And just, I'm not so sure about the boundaries part, but definitely we want to make sure that kids are mindful of what phone use and social media use means and the responsibility that comes with it. So being mindful, everything is permanent. Even those apps that say, it goes away, there's still ways to access it. Everything's permanent. Be safe. Don't share your location, your name, your address, any of that personal information, because that can put you in an unsafe situation. And just have the kids remember to follow their gut instinct. If something feels unsafe, there's a good chance it probably is.
And I think a lot of kids see things happening at their school that they want to tell a parent, or they want to tell an authority figure about. It's important for those children to make sure that they do that, isn't it? Is to do it the correct way.
Yes, go about it through the correct way. Ask a teacher's permission before using your phone if it is an emergency. But also, now that we have cell phones, kids are a little bit less likely to have their parents or their emergency contact numbers memorized.
Right.
So make sure your kids know your number or another caregiver or emergency contact's number before they go to school, so that if they do have a cell phone, they're not relying on that. What if the phone dies or they're not able to access it? So make sure that they still know their names, address,
Yes.
that phone number, all the things that they're usually told to know. So
And a cell phone could be a very good safety line if there's an accident, if something happens and they need to get a hold of a parent or someone in authority. Is this a conversation that parents need to sit down and have with their children before even giving them a cell phone?
yeah, I mean, definitely make sure, encourage kids to make sure they're safe and in a safe location before they reach for that cell
Right.
phone. So if they're in an unsafe situation, don't
Right.
reach for the phone first to call somebody. Make sure they're safe, remove themselves from the unsafe situation, and then reach for that phone to call for help.
Are you finding that most schools around here have safety plans in place that they need to make sure that the children, the students know about them, and the parents as well?
I think we have a lot of great school systems in the area, and they are very diligent with their safety plans and safety protocols, and they're really great about communicating those with parents. But we definitely have to make sure that parents are giving that education and information at home as well.
And Doctor, school is starting back. The
Yes.
kids, we talked about the healthy aspect of things, getting back to class. Let's talk about sports, because
Sure.
a lot of students are participating in sports right now. Football season's underway, soccer's going on, other sports as well. What tips can you offer parents and students for maintaining safety and be healthy
Right.
playing those sports
Right.
this season?
That's a very good question. One of the things that kids love about school and going back to school is getting back into sports, especially things like football, soccer, basketball. They live for this. It's their passion. When I was growing up, it seemed like, we maybe practiced a couple weeks before school and then we just went right back into the season. But now it's kind of a year-round type of thing.
Right.
So kids kind of practice throughout the year, do workouts throughout the year. And, a lot of times we do see injuries because kids are not really aware or not really paying attention to what they need to be doing to avoid these injuries. And to be real honest, a lot of these injuries are preventable, okay? So the number one thing I could tell you is hydration, hydration, hydration. Okay, so we see this at all levels, right? So if you're watching your college football team or your professional football team, you see the guy pull up and he's got a leg cramp, in the third or fourth quarter, that's probably a hydration injury. So it's important that they know the rules of hydration. So it is recommended that if you're going to participate in a game or a significant workout, that you start that hydration 2 to 3 hours before the event. And so drinking about 20 ounces of fluid before you get started with your practice, 2 to 3 hours. And then once you do your event, you need to continue to drink during the physical exertion period. So it's recommended you drink about 10 ounces minimum about every 10 to 20 minutes so that you can continue to maintain hydration. And then afterwards, we want anywhere from 16 to 24 ounces for each pound that you lost during that game, because you'll lose a lot of fluid, exerting yourself. So we want to replace that fluid and not get into a place where we have chronic dehydration that will place us at further risk for injuries. Other things that we can do, warm-ups. Okay, warm-ups, we should be doing dynamic warm-ups. Back when I was a kid, we did stretches.
Right.
We do this a little bit differently now. What we want to do is go through a full range of motion of dynamic warm-ups, and then we also want to do cool downs at the end, and your cool down should be twice as long as your warm-up is, okay? So don't forget about cool down at the end of your session. And then stretching still is important, but we've kind of moved it to the end. So after your workouts, at least 2 to 3 days a week, you need to be involved in some stretching to improve your range of motion. Thirdly, we want strength training, and a lot of programs are doing strength training, but a lot of kids, they get so focused on, well, I want to get my arms big or my legs big, they forget about that core. Okay, core training is very important and to avoid especially overuse or sudden injuries when you first start up your training sessions. A lot of kids would jump into it and they go, oh, I've got so much back pain. Well, that's because their core was out of shape when they started. They just did too much too soon. So it is important to strengthen it along with doing your warm-ups and your workouts as well. It's also important to follow safety rules and have good techniques.
Yes.
Okay, so this is important in your weight room, but it's also important in your sports training. So a lot of kids, they play soccer, football, basketball.
Right.
If they don't learn how to properly plant their foot and have their knee over their ankle when they change directions, that's one of the #1 causes of ACL injury right there. So it's important to have good technique, good coaching, follow what your coaches say. Don't cheat. Things like football playing
Right.
when you're leading with your head,
Yes.
or sliding into base when you're playing softball head first. These things will cause injury a lot of the time. So there's a reason why we discourage that type of activity.
All right.
Also, it's important for protective equipment.
Yes.
Make sure your equipment is safe and it's not worn out, that it fits properly, and that you're using it.
All right. Doctor, we appreciate it. We're going to come back here in just a few moments. We may pick up right there. But our Back to School Just for Kids special continues right after this break.
The Niswonger Children's Network is growing. We've added new pediatric ERs in both Kingsport and Bristol. We're adding 2 new floors to our children's hospital in Johnson City. And across the region, we're working with medical providers and community partners so even more kids get the quality care they need. Yes, the Niswonger Children's Network is growing, just like our patients. Learn more at balladhealth.org/hope rising. The Niswonger Children's Network is growing. We've added new pediatric ERs in both Kingsport and Bristol. We're adding 2 new floors to our children's hospital in Johnson City. And across the region, we're working with medical providers and community partners so even more kids get the quality care they need. Yes, the Niswonger Children's Network is growing, just like our patients. Learn more at balladhealth.org/hope rising.
What does it mean to have a trauma network in the Appalachian Highlands? It means trauma care starts the second you connect with medical personnel after injury, not just when you get to a dedicated trauma center. It means that through a community partnership between Ballad Health, local EMS, specialized trauma doctors, and ETSU's Quillen College of Medicine, we are all working together to save lives and limbs. It means that no matter where you live, if you're hurt, we'll get you to the right place at the right time for the right care.
Welcome back to tonight's program. We've had an interesting discussion this evening with our experts, Tiffany Alford and Dr. Tim Fuller, about the safety of your children as they head back to school. We have a few more minutes left in the show. We would love to hear your questions at 1-888-903-9545. We do have a couple more questions that came in. And Tiffany, I'm going to direct this to you. What are some of the recommendations for social media? What ages are appropriate to allow your children, your students, to be involved in social media?
I think it really does vary on a child-by-child basis. You really have to assess your child for their maturity level, their responsibility, how can they handle the situations that may arise, because as much as we would like to be able to monitor every second, we can't.
Right.
And we have to know how mature they are and how they're equipped to handle situations that they may come across. And going back to what I said earlier, do they know not to give out their personal information? Do they know how to spot an unsafe situation? So just a lot of it is based on maturity level, and it is going to vary on a child-by-child basis.
We had another question come in on the phones as well. It says, what are some ways to cope with or prevent bullying?
Well, that's a very good question. In fact, I had a learning collaborative that I run out of my office for Northeast Tennessee, and that was the topic today that we talked about, was bullying. So this is perfect. So bullying is a thing that we often deal with as pediatricians as well, from both sides. So I have some parents that come in and they're concerned about a child that they have in their home that is actually the one committing the bullying. And then we also have more often people come in that are being bullied, okay, and they want to know what to do. And there are certain populations that are higher risk. Most of these people that are higher risk, they maybe they don't socialize as well, or they just kind of don't fit in as well, or they may have some sort of chronic problem that keeps them from participating, and so they become a little bit of a target for those people that would choose to pick on a weaker type of individual. And whenever you have a bullying situation, it's a problem with a differential of power. Okay, so you've got one person who's trying to invoke a power assertion over on another person. And bullying doesn't always have to be physical. Sometimes it's verbal as well. But prevention, the biggest thing that you can do is to make sure that that person who is being bullied knows that they have an adult at school or an adult at home that they can go to,
Right.
and they can confide in, and they can let them know what's going on so they can come together and have a plan to address this. A lot of schools have bullying plans in place, but if they don't know the bullying's going on, they can't do anything about it.
All right, Doctor, we're going to go to the break right now, but we'll be back to wrap up Just for Kids Back to School special coming up in just a few minutes. Great points, though, Doctor. Thank you.
What does it mean to have a trauma network in the Appalachian Highlands? It means trauma care starts the second you connect with medical personnel after injury, not just when you get to a dedicated trauma center. It means that through a community partnership between Ballad Health, local EMS, specialized trauma doctors, and ETSU's Quillen College of Medicine, we are all working together to save lives and limbs. It means that no matter where you live, if you're hurt, we'll get you to the right place at the right time for the right care.
The Niswonger Children's Network is growing. We've added new pediatric ERs in both Kingsport and Bristol. We're adding 2 new floors to our children's hospital in Johnson City. And across the region, we're working with medical providers and community partners so even more kids get the quality care they need. Yes, the Niswonger Children's Network is growing, just like our patients. Learn more at balladhealth.org/hoperising. The Niswonger Children's Network is growing. We've added new pediatric ERs in both Kingsport and Bristol. We're adding 2 new floors to our children's hospital in Johnson City. And across the region, we're working with medical providers and community partners so even more kids get the quality care they need. Yes, the Niswonger Children's Network is growing, just like our patients. Learn more at balladhealth.org/hoperising.
Welcome back to our Just for Kids Back to School special. We want to say thank you to Tiffany Alford with the Children's Resource Center and Dr. Tim Fuller from Ballad Health Medical Associates and Green Mountain Pediatrics. And Doctor, we got to let everybody know you won a very prestigious award this year.
That's true.
Tell us about it.
So we recently had our Tennessee State Pediatric Conference, and one of the things we do there is we honor different individuals for accomplishments such as lifetime achievement and so on. And this year I was selected as the Pediatrician of the Year for the Tennessee chapter of American Academy of Pediatrics for contributions to the state of Tennessee and to TNAP. So,
well, with the information you gave us tonight, I can see why you were named that. And Tiffany, before we go, you have a very special event coming up with the Children's Resource Center. Tell us about it.
So on October 22nd at King Commons Park in Johnson City, we have our Scarecrow Skedaddle 5K, 1 mile fun run, modified race, and shindig. So we'll kick off at 1:30 for our races. Little bit of something for everyone. Like I said, we've got that 5K for those intense runners. We've got a family 1 mile, and we've got a modified race for those who may need some modifications. And then we've got a fun shindig with vendors, and everybody can dress up and come out.
Thank you so much. Everyone, thanks for joining this evening for Just for Kids.